Well, good morning and welcome to Valley Views. I'm your host, Glenn Edison. We're certainly glad to have you today, and we're thankful for BTC Fiber, our program host, and you can catch us on YouTube at the BTC Fiber YouTube page. So thank you for catching up with us, and we appreciate you. And today we have with us Dr. Karen Ray Shepherd, our local doctor, and she has many titles, and we're going to go over those titles with her and to let you know. But Dr. Shepherd, it's good to have you today, and we appreciate you being with us.
Glad to be here.
Now, I know you've been around ever since I've been here, and I've been here over 35 years. How long have you been as a doctor here?
Well, I came back to practice medicine in '86. The governor of Tennessee said homecoming '86, and I came home.
So you've been around a while for that.
Yes.
And you didn't always, when your career didn't start as a doctor, you were a high school English teacher, is that correct?
I taught sophomore English at Sequatchie County High School for 3 years.
3 years. And then you decided you're going to follow in your dad's footsteps?
Not exactly. I had been aimed that way, and I segued into teaching because there was still a lot of prejudice against ladies in medical school. And so I wussed out and came home to teach school, and after 3 years of teaching, I figured I could do almost anything. My class of 73 take credit, and I give them a lot of credit. Every time I thought, well, it's a little hard, I thought I could always go back to teaching, and then I thought, I believe I can study harder.
Yeah. Well, and I know that as a doctor, it takes a lot of study, a lot of burning of the late midnight oil, huh?
24/7.
And you're still, even once you get your degree as a doctor, you still study and learn all the time.
You have to do continuing education all the time, because what we think we know, we discover was not quite correct, and we have to have changes in what we believe is true. Also, there's new medications. When I became a physician, there was at least 3 classes of blood pressure medication that did not exist at all.
Well.
And so I've been lucky to get to see a lot of really fabulous changes. Used to, if we had to take out your gallbladder, we opened you up from the middle of your chest to below your belly button and sorted through all your parts. Now we can put a little ding in your belly button, put in a little scope, put in a couple of things that look like knitting needles, lift up that gallbladder, use a clip that's attached to the scope to fasten it off, and pull that food back out through your belly button. And we don't have to heal the torn tissue. You're almost ready to go back to work the next day, just because we don't have all the terrible damage that had to be done before we learned how to do these wonderful new surgeries.
Yeah, and there's so many, I know, well, since I've been around, the changes in surgeries, what used to be, well, for example, heart surgeries.
At this point in time, I don't know how, because I have not had the opportunity to go in and observe it, but you can go in with what looks like a catheter, an IV catheter. And again, it's got little gizmos on the end of it, and you go in and you can, besides placing pacemakers, now you can go in and put in replacement valves depending on the condition of the heart, which in some cases you can just trade out valves through this thing that looks like a really big IV catheter. And that's a whole lot better than cracking your chest.
Oh, yeah. I know I've had stents. And
the stents work like that, except this is just kind of gaming it a little bit farther.
Yeah. And I guess also even just the treatment of just everyday colds.
No, we haven't changed on the cold, sadly enough. We don't, but the cold is the original coronavirus. A lot of people don't understand that. And it mutates so much, that's why we don't have a vaccine for it, because you'd have to have a new vaccine about every 6 months. And I'm not even sure on that, but the whole thing is that it mutates, and it's never been cost effective to try to get a vaccine for the common cold. it's been thought of more than once, and if somebody comes up with something magic, we'll all be really happy with that. But the fact that we came up with a vaccine for the coronavirus in such a short period of time was partly because we were looking for other vaccines for other coronaviruses, and they were augmented to cover this specific one. And so the SARS epidemic a few years ago probably helped us be where we were, and so that we could come up with one in a more timely fashion.
Well, good. Because I know a lot of people were skeptic about it even coming out with one in just a few.
The answer is I was too. Because there's a lot of rules that you have to go through, and people say, well, why does it take so long? Well, you've got to give this, and then you got to wait and see how many people have a bad side effect. Then you give more or different, and you see how they're doing, and then you try to give them the virus. And if they manage to not get the virus, and they do well, that's good for your thing. But if they manage not to get the virus, but they do badly because of side effects, that's not okay. And you have to have so many days, and we're talking about more like months, to see what kind of effects you're going to have. That's what takes a lot of the time, and that's one of the reasons when you have it rapidly that you're concerned. But some of these people were already searching coronaviruses, just not Corona-19. So they had a lot of their baseline covered, and so they were able then to go on and cover a specific Corona-19 as opposed to a coronavirus in general.
Well, good. That helps speed things along then.
It was tantamount to a miracle, really.
Well, now how, since we are speaking of the coronavirus, how has that been medically, locally?
Okay, well, for the most part, if we're well enough to go home, we try to keep people at home because, one, we need the hospital beds for the people who can't be at home, the people who have to have the respirators. And so if we can save our hospital beds and you're well enough to be at home, then it's like having a really horrible flu. I mean, that's reducing it to the ridiculous, but once you've got the respiratory side effects where we're concerned about your breathing, you're a hospital patient. It's not an option. But I've been lucky enough to have several patients who are able to be cared for at home, and there's no special medicine for it. You're treated symptomatically. The story about steroids. Well, yeah, steroids block inflammatory response. But if you're not having the inflammatory response, they don't do anything for the coronavirus. So it's not a magic pill like the TV sometimes implies.
Yeah.
If you've got joint inflammation, the steroids are going to help. If you have lung inflammation, the steroids are going to help. If you don't have these, steroids are going to make no significant difference as far as positive. And so then they're not the appropriate medication to have.
So there's just a lot of, you have to do a lot of guesswork sometimes.
Well, it's the art of medicine. You look at the patient and you treat the individual symptoms, and you have a basic dose that you start at. And then if it seems to be working but not good enough, you will increase the dose. If it's working ta-da, then you're going to leave them at that dose.
Well, good. That's I know it's affected several here locally. We've had, of course, some deaths.
Oh yes, and very tragic because there were young people that were important to our community. I mean, not that anybody wasn't important, but I mean they were active as far as health and law. These were people who were working in our community, helping other people.
Right, and a lot of those people were healthy one day, and then bam, the next day they were sick.
Right. Well, a lot of things happen with particularly young men is they deny that they're sick. And they keep saying they're okay until they're seriously not okay, at which time sometimes it's a little late. And that is one thing that ladies are a little more prone to saying, well, I think I'm getting a bug. Whereas a guy says, nothing wrong with me.
Oh, well, that's probably true. I probably identify with that a little bit, but well, we'll hope. I know I was talking to someone the other day. It seems like it's being talked about less, except for the people that maybe you hear stories of people dying from the shots, and, or at least that's what they allege. It was.
I don't know of anybody who's died of the shot. I know of some who have had anaphylactic reactions, and it's not the shot against the virus, it's the carrier of the medicine against the virus that is most often causing it. If you have a true allergy to eggs, then some of the shots are grown on egg yolk. I mean, I'm exaggerating, it's a little more.
Right.
And so you're going to get the protein from the egg, and if you're allergic to it, you're going to be in trouble. That's why we ask you, do you have allergy to eggs? And that's each of these things are very important. I have patients who don't take the flu shot because it's produced with egg protein, and we would like them to keep on breathing. We don't want them to get the flu, but we don't want it to, one of the most important things that we're taught in medical school is first, do no harm.
Right. And well, that's true. And like I know in my case with my liver transplant, I didn't know I had a iron overload until someone thought I had cancer because of my blood count.
Yeah, well, and most people don't recognize it. They say, well, how can iron hurt you? When your liver turns into big rusty something or other, you're in serious trouble.
Yeah, and that was the case for me.
They don't think about it, but it's like you're rusting.
Right. Yeah, really. Well, now let's change routes for just a minute. Now you serve as a county coroner,
A medical examiner,
and so that, of course, you're not always busy, but you stay busy.
Lately we've been a lot more busy than we would like to be. I mean, we want to be available, but we've had a lot of deaths, and I'm not talking about the deaths from COVID, because most of our people who died of COVID died in another county because they were sick enough that they were transferred to their facilities. But I see the people who are the suicides, I see the people who are presumed homicides, and these are the ones where we do evaluation, but then we send them to autopsy, and our autopsy location is in Nashville. And it's part of the state medical examiner configuration. And they do the autopsies, and then they provide us with the information, and this is when our district attorney of the region will then take it to court.
Oh, I see. So you have primarily waiting on the state to give you the results before you can pronounce anything.
I determine that they're dead.
Right.
We have people who we find dead that we don't think there's any reason to suspect foul play, but they're 27 and they shouldn't be dead. So that gets evaluated. If they're 27 and they've had 2 transplants and 3 pacemakers, we kind of have a clue, and they don't necessarily go for autopsy. If they look like somebody caved in their head with a tire iron, they go for autopsy.
Right.
Now, there will be a number of things that will create mitigating circumstances as far as, was this person intoxicated and standing somewhere where he could crash his head into a piece of metal that was fixed? But there's evaluation of what's the underlying cause of death. Were there any other things to be found, like I said, drugs or alcohol? Heart attack. You can have your head bashed in because you fell and hit it on the way down from your big major heart attack. So these are, the things we're looking at.
Oh, okay. Now, were you going back to that, were you one of the first female doctors here in the county?
I probably was the first female physician here in the county. We had a number of ladies out on the mountain that were, quote, granny ladies. And the granny ladies did mountain medicine, and they had training. They didn't have formal training, but some of them I would trust with herbs over anybody else, especially these herb shots where some guy says, well, somebody said this is good.
Yeah.
These ladies knew what it did and had some knowledge of physiology, although it was not formal training.
Right. Well, good. And what about now? Let's go into, I know you're a Lions Club member, but you were one of the first female.
I was the first female lion here in Sequatchie County. There were female lions in other places in the nation, but I was the first one here in Dunlap.
And how long have you been a club member?
Well, 20-something years.
20-some years?
I'm not sure exactly what year that was, but I was around 25.
Good. That's a good mark. And
Yeah.
of course, the Lions Club does a lot of things locally, to help people in various ways.
Very proud of our Lions Club. I think we do a really good job. Certainly, when we fail to do what somebody expects of us, it was not from lack of trying. We don't just say, well, it's not worth it. It means that we were out trying and we maybe didn't meet the other person's mark, or even for that matter, our mark as far as what we wanted to do. But we try to help with people who need glasses. We try to help with people who have hearing issues. And we help with, at Christmas time, we help with toys and food baskets for the community. And throughout the year, we have other programs that we help with and we contribute to the White Cane International.
Right.
And we have a lot of other things, and I'm sure that somebody's going to hit me over the head and tell me you didn't remember so and so. But we do a lot of work as far as our contributions go, but we do a lot of hands-on work also. And that's the part that I really enjoy, is being able to be out there with the community working. And
talking about the working, kind of getting away from that, your office is located here in downtown historic Dunlap.
Yes.
Can you tell us a little bit about the building?
Well, the building was a C.E. Burroughs store, and now this is somebody who doesn't have the real history on it, but it, to me as a child, looked like the company store. It had everything about where my office within the building sits. Is where it started, and there was rows and rows of high-top boots where everybody came in the fall to get their shoes for school. There was, on another row, I think about where my records are, there was mercantile, lots and lots of fabrics and stuff for ladies to buy and make their garments. I don't know about ready to wear. I'm thinking that there was ready to wear, but I was a pretty little kid when I went in there, and I wasn't particularly interested in some of the stuff that was there. There was the things that found my attention was there was a sales lady that was a rather tall, large-boned lady, and she was not by any means intimidating, but to me, that's 2.5 feet tall, she was pretty big. And I was always impressed with her, and she worked in cutting the yard goods for people.
Well, yeah. So that you're part of Sequatchie County history by being the first woman in the Lions Club. Your office is in downtown historic Dunlap. You need a lot of history behind you.
Well, I hope so. I was because I was the school teacher, mostly I did the English, but English is how we convey information, and one of the things I did do was try to teach them how to write down the information so they could pass it on to the next generation. And that was, at least, that's what I believe sophomore English is supposed to do, is teach you how to write clearly so that you could tell somebody what you knew and what you wanted to convey to them.
Well, do you have anything else you'd like to share with our viewers today before we shut down?
Well, no, except if you have an opportunity to get your shot for the coronavirus, I strongly encourage it. And if you didn't get your flu shot this year, I encourage you to do so next year.
All right, well, Dr. Shepard, we certainly appreciate you being with us today and sharing with us all your vast history. And folks, just remember, she's encouraging you to get that shot for the COVID if you haven't done so already. And we're certainly glad to have you today. And watch for the BTC Fiber YouTube page. That's where you'll see our video and our interview. And also on Channel 18 of BTC Fiber cable channel. So until next time, we'll see you later. Hey everybody, this is Glenn Edison from Valley Views. We appreciate you watching our shows, and we would like for you to like, share, and follow us on Facebook, as well as like and subscribe to our YouTube page.
Brought to you by Bledsoe Telephone Cooperative, your full-service telecommunications provider right here in the Sequatchie Valley.